Really pleased to be joined by Dr Rangan Chatterjee, and many of you will know him as the resident doctor on BBC Breakfast. He's had his own TV series, he's a published author and a doctor, if that wasn't enough. And he's joined us today to talk about, in this Mental Health Awareness Week, and also with COVID and the effect on policing and police officers trying to do their job, because it's really tough. So you're really welcome. Thank you so much for doing this. I really appreciate it. And I know
John,
many of our members, we represent police officers all across England and Wales, and they're out there doing the best they can. And what we find with police officers is that they're not very, whether it's a macho image or we just want to get on and do our own thing, we don't really say when we're having problems, whether that's mental health problems, whether we're not eating properly, sleeping properly. What would be your advice to my colleagues who are struggling a bit in this crisis and at other times?
Yeah, first of all, John, thanks for inviting me on. And the first thing I'd like to say is a big thank you to you and all your members, all the police around the country who are trying their best to steer the public through these very challenging and quite frankly, very, very odd and difficult times. So just want to say, I'm sure the British public, but also myself, very, very thankful. So keep on doing the great work for sure. That's the first thing I want to say. But then on to your question, I think no matter what profession you're in at the moment, and I suspect it's probably more acute for police officers, people are struggling. A lot of people are struggling. They feel nervous, anxious about their own health, about their family's health. And then also in the role that police have, there's a lot of pressure anyway to be, doing the right thing, being seen to do the right thing when maybe not all of the public agree with what is being asked of them. So I can't imagine those challenges. They must be very, very tricky. So what can we do about that? Well, the first thing is to recognize that actually it's okay to say that it's a bit tough and you're feeling a bit down or a bit anxious. That's okay. And actually, one thing we know from the research and from clinical experience is not acknowledging it and pretending everything's okay, isn't the best way to manage it, because that's when stress and anxiety starts to build up. It just builds up in your body and it can start to impact your ability to do your job calmly and efficiently. It can then start to impact your home life, let's say with your partner or your children. It can start to cause issues with relationships. And so simply acknowledging it sounds so simple, but without an acknowledgement of it, it's very hard to do anything about it. Burying your head in the sand, certainly men and women tend to be, broadly speaking, a bit different in this regard. As a general rule, of course, there are exceptions on both sides, but often men don't like to talk about things and they feel it's a sign of weakness. But actually, we know that talking about it with your colleagues, saying to one of your colleagues, let's say you have a break, say, hey, look, how are you finding it? I'm pretty nervous at the moment. Now, there was a member of the public yesterday, he was coughing. I don't know if I might have coronavirus. My son at home's got asthma. Even saying it, acknowledging it, really helps to lower levels of the stress hormone cortisol in your body. So it really does make a difference.
That's really interesting, because I know with policing, I've been a police officer for 27 years. And in the early days, I think, if you dared to say that you were struggling, whether you'd seen something unimaginable or the pressure of work was just getting on top of you, many colleagues would say, they'd use the phrase, oh, come on, man up. And we've actually got a campaign at the moment called Man Up, Man Down, because I think people really need to understand that pressure. And some of the simple things that you're saying really do resonate. So talking is really important. And I just want to expand as well on, in this current crisis that nobody would ever have predicted we would be in, my colleagues are out there engaging with the public, very often having to get hands-on with members of the public who are, we don't know whether they've got the virus. And then my colleagues then going home to their families, and there's some real fear there with police officers. And I know the same with the NHS and paramedics and others. What would be your advice to them?
Look, first of all, just to re-emphasize what I've already said, acknowledge that you're worried. That's okay. Share it with a friend, share it with your partner, phone a colleague when you get home if you've got that sort of relationship, and say, hey, look, mate, I'm petrified that I've picked something up and I really don't want to give it to anyone. You know, that's the first thing. But then the simple things, you know, when you go home, wash your hands. You know, wash your hands for 20 seconds. Like, although that's advice for the public, it's the same advice, the simple advice works for all of us. We just got to remember to do it. You know, find that song that you get into the house and sing for 20 seconds when you're washing your hand, whether it's happy birthday twice or whatever it is. It's not only does it help in terms of physically killing the virus, what it also does, it has a very powerful effect of routine, of you feeling that you've got a sense of control. Ah, cool. You know what? I had to do my job for the public. I'm very proud of my job. I had to do what I had to do. But now I'm back home now. So now I'm going to take sensible precautions that I know are going to kill the virus, right? And I know it's small and it doesn't eliminate the risk to zero. I'm not going to try and patronize anyone. There is a risk. There is a finite risk of picking this up. That is true. You know, the only way to bring the risk down to zero is to have zero human contact between anyone for a prolonged period of time. And that really isn't the sort of society that anyone wants to live in. You know, we have to accept that there is an element of risk in everything we do. But I will also say, just to provide a bit of perspective, and I know it feels scary at the moment, but in the winter months, you know, before coronavirus, when your police officers are out helping members of the public, there was always a risk of picking things up, like flu or a bad cough or a bug that you could bring home to your family. And I don't mean that to trivialize the matter. I'm just trying to bring a bit of perspective to go, yeah, people like your officers, people like me who see patients, we, you know, that's part of our job. That's what we train for. That's what we've signed up to do. It's to help society and to help people. But I think for most people, if they take sensible precautions, that really will be sufficient. But if you really are worried, then yes, you know, you can. Your GP surgery is still open. You know, you can phone up and say, "Hey, look, I'm really worried. What should I do?" You can get that advice.
No, absolutely. I've read some of your books, and what I find fascinating is some of the simple things can be the most effective. And certainly with police officers and other shift workers, what we find is, you know, sleep patterns are disturbed terribly, and also people then eat at irregular times and very often eat the wrong things. I think policing has recognised that in recent years. We're trying to do something about it. But what would be your quick tips to shift workers? Maybe they're struggling with sleep, struggling with trying to get a balanced diet. What are the
Okay.
simple things that they can do?
Yeah. So let's deal with sleep first, because I think sleep, we know now that some people make the case, and I think it's pretty accurate, that sleep may well be the most important pillar of health, because you bulletproof yourself, you insulate yourself to so many other problems when you've slept well. When you haven't slept well, you make worse food choices. We know that you're hungrier the next day when you haven't slept well. You crave more sugar. You're emotionally more volatile and reactive, which means you're much more likely to get into arguments and rows with family, friends, colleagues, even members of the public. Let's say in a stressful situation, right, where tempers are sort of flaring. Your ability, I'm sure it's the same in your job as it is in mine, you've got to stay calm. You can't react to that. If you've slept well, you're much more likely to respond appropriately and professionally. Now, that doesn't help you get to sleep. That just shows you that sleep is a priority. Now, there are many things you can do to help you sleep. And just remember that most sleep problems are lifestyle problems. Okay, the vast majority of people who struggle with their sleep, there's something going on in their lifestyle that's stopping it. Very few, as a proportion, are actually sleep disorders that need treatment. They do exist, but by and large, they're unlikely to be significant for most people. So, what do you do in the 1 hour before bed? If you are watching Newsnight, if you are watching something that's going to get you het up, if you get into a row on Twitter or on Instagram or on Facebook, you know what? It is going to impact your sleep. It impacts your sleep because you're emotionally stimulated. It also impacts your sleep because all these devices have something called blue light that gets emitted from them. And we know so clearly now that looking at blue light before bed impacts your sleep, right? Some people say, oh, I'm fine, I can sleep. Well, you know what? If we measure the quality of your sleep, it looks at the moment from the research that it's not as deep. So can you, for 1 hour before bed, switch off your screens? If you can't, can you start with 10 minutes and build up? Because some people can't. They say, no, doc, I can't do that yet. Okay, fine. Really protect that hour before bed. Try and do relaxing things. You know, if you're lucky enough to have a partner or someone you live with, have a chat with them. You know, don't necessarily just go and immerse yourself in more solitude, more sort of YouTube videos, more Netflix. I get that. That's often how we unwind. But let's not forget, human connection is so, so important for our well-being. And if you're lucky enough to have other people around you, not everyone is, I recognize that, use it. Even if you commit to just 5 minutes of meaningful connection with them, that will really, really help. Having a bath, okay, right? It sounds so simple, right? Having a bath, a hot bath, helps you sleep at night. It does, and it's a simple thing. And what I love about it is it's a bit of enforced relaxation. It's kind of like what I was doing, because, you know, the first few weeks of the pandemic, you know, everything was shifting. I was feeling really quite tired, a little bit anxious. I was trying to juggle all kinds of things. And as I was putting my kids to bed in the evening, I'd run the bath. So once they were in bed, I sort of thought to myself, oh, I've just spent 20 minutes, you know, filling up a hot bath. I'm going to go in the bath now. Like, and, you know, I slept like a baby because suddenly then I wasn't stressing about other things. It was enforced relaxation. So again, I didn't grow up being a bath type of person, right? This is a new thing for me, but it really does work. It's the simple things that make a massive difference.
I think that's what really comes out from our conversation. It is those simple things. And when you talked about that human interaction, that human connection, certainly for policing over the past several years, police officers have been working more in isolation. They've been briefing separately. They've been out single crewed. They'll go to traumatic incidents and they've not been debriefed. They've not spoken with their supervisors that much. And I've been really trying to emphasize that just that human connection, talking to your colleagues, can be so beneficial. And unfortunately, we've been pushing against some pretty solid locked doors up until recently. So it's good to hear you say that interaction is so important.
It's important. And even, look, I obviously don't know the exact dynamics of how different forces work and your different members work. But if there are ever any team meetings, let's say, and I appreciate that may be done online or in some sort of digital form or with some sort of distancing, even just a minute of checking in, saying, hey guys, look, before you get into the actual work, it's like, hey, how's everyone doing? You know, it's pretty mad at the moment, isn't it? You know, I mean, how are you guys all feeling? Yeah, you know what, feeling pretty stressed or whatever. But I've been talking about well-being to all kinds of companies for the last years, whether it's Apple, Google, Facebook, you know, whatever it is. And I always say at the start of meetings, take a minute, either do a breathing, some sort of deep breathing exercise, or just check in. And they all feedback saying, oh, the quality of our meetings is so much higher afterwards because people feel heard. Right? People feel heard and everyone wants to feel heard. Just on sleep, John, I just want to add another really important thing, that a simple thing that might help. Journaling, right? Journaling is the idea where you write down your thoughts, right? It is so, so effective and it's simple, it's free and it's cheap, right? So here's the idea. If you've got anxieties and worries in your head and you do nothing to process them, they stay there and they can start to affect your sleep. They can start to affect how stressed you feel. If you come back from shift or first thing in the morning, whatever way you want to do it, you write down. Like I do this most mornings for 5 minutes. I've got a pen and paper next to the kettle. So as soon as I've made my hot drink, the pen and paper are right there. And I just start writing anything that comes to my head. Oh, you know what? Bit of a stressful day yesterday, but this was really good. I know it sounds simple, but this can really help with anxiety. You know, I've got patients since my last book came out, which is all about 5-minute health snacks that we can do each day. So many people have messaged me and saying 5 minutes of journaling each morning or each night has got rid of our anxiety, because it literally and metaphorically takes your thoughts and your worries out of your mind and puts them onto paper. So it's just a simple thing. It may not be for everyone, but it does work.
Yeah, I think what I'm certainly taking from you, you know, and I've said before, Doc, that policing has had a bit of a reputation that, oh, we don't need any help or support, almost like we're robots, but we're not, we're human beings. And yeah, we're professional and we want to do the best we can. but we're not immune from, suffering from mental health crisis, which is just as impactful as physical.
Well, what do we say on a
physical.
plane, John? What do we say on a plane, right? Before the air mask comes up, before you put your child's air mask on, you put your own on, right?
Absolutely.
It's no different. If you want to be as good as you can in your job, right? A bit of self-care each day is actually in many ways the most responsible thing you could do. You will be a better police officer. You will be, for me, I'm a better doctor. I'm a better father. I'm a better husband when I've done a few little things for myself each day. I've observed it. Like when I've done a 5-minute workout each morning or 5 minutes of journaling, I'm a better dad, right? I'm a better husband. And when I don't do them, I sort of feel I've not had time to myself. I'm not, it impacts so many things. And John, to make this super practical for people, right?
Yeah.
Because there is a wealth of health information out there, and to the point where it's like, oh my God, there's so many amazing things I could be doing. Where am I going to start? I've got this sort of framework that I really think helps all of us, right? And it's 5 minutes a day on your mind, 5 minutes a day on your body, and 5 minutes a day on your heart. I'll explain what I mean. 5 minutes a day on your mind is your mental health, right? That could be journaling. It could be doing like there's a really cool breathing practice called 3-4-5, and I've got some police officer patients who use this in between shifts or when they're getting stressed. And basically, you breathe in for 3, you hold for 4, and you breathe out for 5. Right? It's super simple. You do it for about a minute. It's so easy. And basically, anytime your out breath is longer than your in breath, you start to switch off your body's stress response and activate its relaxation response, right? So that's a very simple breath called the 3-4-5 breath. Some people may want to try it. I would say to people, 5 minutes a day on your mind, right? And I'd say 5 minutes a day on your body. You've got to move your body, right? You've got to move your body each day for your physical health, but also your mental health. So it could be that you do star jumps for 2 minutes. It could be that when you get home, you crank on your favorite music and you dance in the kitchen for 5 minutes. That's what I do when I come back after clinic with my kids, right? I literally crank on a CD and we dance together. And you know what? That's movement. Who says it has to have a name like weightlifting or spinning? No, that counts, right?
Absolutely.
And the final thing is 5 minutes each day on your heart. That's about human connection. Have you connected with another human being for at least 5 minutes a day? That could be a phone call to your brother, to your friends. It could be to a work colleague. It could be to your parents. But it's such a simple framework, and it means that if you just try, if 5 minutes is too much, do 2 minutes on each, right? It's the daily habit of doing them that makes the difference, right? I'll give an example, which I really think it really brings it to life for people. If we talk about dental health, right? We don't think, I'm not going to clean my teeth for 6 days, but on a Sunday, right, I'm going out for my 1 hour deep cleanse on my teeth, right? No, we don't do that because we know that the way we keep our teeth in good shape is by doing 4 minutes of brushing every day. We don't just do a 1 hour brush on a Sunday, right? And it's the same thing with physical, mental, and emotional health. Don't make it difficult. Make it super simple, super easy, but do those small things consistently. I can tell you in nearly 20 years of seeing patients, these are the changes that actually make the difference. You feel each day that you're doing something for yourself, that no matter how stressful work is, no matter how stressful it is out there, you still prioritized 2 or 3 things for yourself each day, and it feels really, really good.
Excellent. I think the simplicity of what you say, and I know the effectiveness, although seeing some of my colleagues dancing in the kitchen would probably cause more of a problem for my mental health. But and I'm certainly going to take on a personal level. The journal sounds fascinating because I think I do that anyway, but I don't write it down. And the breathing, and we all have stress, different levels of stress, and the job itself for policing is really tough. But then you've got all of the home stuff as well that goes with it. So I can't thank you enough for taking the time to just give some tips to my colleagues and give them that reassurance, and also, Doctor, your support, because people like you to say thank you to policing means so much. Thank you so much.
Not at all, John. And good luck to you and all of your members.
Thank you. Thanks very much.